Hi, this is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today I'd like to present an interview with a patient that we've been working with for the past 6 months. This patient's case is particularly important because it's a classic example of one of the more common conditions that's now plaguing our population. And that's a condition known as gastroesophageal reflux disease, or what's more commonly referred to as GERD, or acid reflux. I've got a question for you. Have you ever taken an antacid? If you're like the average American, you probably laughed and thought to yourself, well, hey, that's like asking if I've ever breathed air. Now, the reason I say that is because upwards of 50% of our population has or is currently taking an antacid preparation of some type, whether it be prescription such as Nexium or Prevacid, or an over-the-counter preparation such as Tums, Mylanta, or Rolaids, just to name a few. The fact is that most Americans take an antacid on a daily basis, and what they fail to recognize is that the use of them oftentimes results in much more significant health issues, such as the onset of severe and chronic gastrointestinal disorders, as well as systemic type illnesses. Antacids oftentimes do much more harm than good, and here's why. Acid blockers do more than neutralize the acid in your stomach. They neutralize or essentially destroy your ability to properly digest your food, particularly your proteins. That's right, your stomach needs the acid to digest protein. If the acid gets neutralized or stopped, digestion effectively halts. The maldigestion of proteins causes them to putrefy or essentially rot inside your gut, causing the bowel to become toxic over time. The lack of acid also disrupts the onset of the alkaline tide, which is needed to activate digestive enzymes in the small intestine. The damage doesn't stop there. Antacids reduce the ability for your body to effectively utilize calcium and other minerals. The acid in your stomach works to make the minerals we ingest soluble. Without the acid, we are at a much greater risk for developing conditions such as osteoporosis over time. Studies have shown that long-term use of certain acid blockers increase the risk of hip fracture by 44%. Larry the Cable Guy doesn't exactly talk about that on his Nexium commercials, does he? And still, the fun doesn't stop there. The hydrochloric acid does more than digest proteins and make our minerals soluble. It also acts as a protective barrier for your body. Each time we ingest food, we also ingest a variety of bacteria and other potentially hazardous pathogens. The acid in the stomach typically destroys these dangerous bugs and prevents them from entering the small intestine. But when your stomach acid is neutralized, the protective barrier isn't there, and these invaders can get into your intestinal tract. Over time, abnormal and pathogenic bacteria begin growing in the gut, leading to a variety of symptoms and greatly increasing the risk for severe gastrointestinal dysfunction and systemic illnesses to set in. As you can see, the use of antacids is really a recipe for disaster. Approximately 50% of the patients we work with at the Goldberg Clinic have or are currently taking an antacid preparation of some type when they come to see us at their initial visit. The resulting gut dysfunction that occurs following the use of antacids has, for many of them, contributed to the onset and development of many systemic illnesses, including rheumatoid arthritis, lupus, chronic fatigue syndrome, fibromyalgia, ulcerative colitis, Crohn's disease, allergy, just to name a few. The following patient interview is a classic example of what can occur following the use of antacids. In working with this patient, it was our goal not to treat her condition or her symptoms, but rather to identify and address the causes of her health problems and create the ideal conditions under which proper gut function could be restored and overall health could improve. In just 6 months, the patient has seen an 80% improvement in her health, as you'll see in the following interview. Hi, this is Dr. Tenner here at the Goldberg Clinic for Chronic Disease Reversal, and today we have with us Ms. Shanta Williams. And Shanta came to see us back in July of 2012. Shanta, please tell our audience a little bit about what brought you in to see us.
I initially came to the Goldberg Clinic with problems of constipation, bloating, lots of acid reflux. I had lots of horrible skin issues initially. So those were some of my symptoms coming into the clinic.
Okay, and it's my understanding that you had sought medical treatment for these issues, and so you went to see your medical doctor, and what did they tell you?
My medical doctor told me that I had acid reflux, or GERD, and so I was prescribed Prevacid or acid blockers, and I took that for a few months. Didn't have a lot of success with that. I always, would sometimes regurgitate my food from taking those, the Prevacid. So I wasn't on it for long. I just couldn't do the medication. I had issues with, I noticed after that my hair started falling out. My skin issues were even worse than what I initially had. So I got myself off of it.
Okay. I think it's important to point out that gastrointestinal issues, particularly the ones that Shanta was dealing with, from constipation to irritable bowel type symptoms, are becoming increasingly common in our population today, as well as acid reflux. And one of the most common treatment protocols for these issues is the prescription of acid blockers, things like Prevacid. And while they may temporarily relieve the patient's symptoms, they tend to cause way more problems than good. The acid in your stomach is necessary in order to digest your proteins, make your minerals soluble, and kill off any bacteria that might make its way down into your GI tract. And so if the acid's not there, it opens up the potential for serious problems to occur. And we see that quite often in patients. We oftentimes see patients who have gastrointestinal issues then develop things like autoimmune issues, skin problems, amongst other things, simply as a result of taking acid blockers over time. So we had Shanta into our clinic. We did some investigation with her. We discovered what's called a small bacterial overgrowth as a result of taking antacids for a period of time. And so we developed a program for Shanta to follow, an individualized program specific to her needs. And over time we started to rebuild her health and restore proper function to that GI tract. Okay, so Shanta, what kind of changes have you noticed over the last 6 months?
Oh wow, significant changes I would say in my skin. My skin is improved. I don't have the bloating and the burping like how I used to, and my bowel movements are, pretty consistent at this point. So no more the constipation as I used to have. Lots of changes. I would probably say about 80% improvement in my symptoms that I came in with, so much improved.
Well, we're very pleased with the improvements that Shanta has made over the past 6 months. We still have some work to do, but we've seen a lot of progress made, and which is largely due to the fact that Shanta has put in the hard work in order to make these improvements. We can only do our best to point the patient in the right direction, but the patient has to go home and do the hard work and have the will to get well, which Shanta does. So Shanta, we look forward to continuing to improve upon the progress that you've made thus far, and we thank you very much for joining us today.
Thank you, Dr. Tanner.
Thank you.